Hello, I'm called Anorit. I'm going to talk more about healthcare. In this project, I'm going to enumerate clinical and non-clinical and their role, and also I will provide more example by explaining what is area of healthcare professional, and I will describe what is LPN and LN, and also I will come up with more examples so that someone who understands me can know more significance about that. Clinical role often have face-to-face contact with patients for the purpose of diagnosis, treatment, and ongoing care. Some clinical professionals are behind the scenes, such as laboratory professionally whose work support diagnosis and treatment. These are the law of professional provide directed patient care. The clinical can provide the law of someone must be physician. Physician it can be the doctor typically treat patient, although depend on their administrative duty. It may become less prominent as with department chief. Also, there is the hospitalist. A hospitalist is a physician who specializes in the care of hospitalized patients and whose practice is in the hospital, not in the office. Physician assistants. Also, it provides a broad range of healthcare service that were traditional performance by a physician. There is also nursing practitioner who provide the same level of care provided by primary care physician and can serve as a patient regular health care provider. Also, there is the registered nurse who provide care of patients and assume primary responsibility for the care of the patient and direct the care provided by other caregivers. Also, there is the licensed practitioner nurse who assists with coordination and the implementation of the plan of a care as delegated by clinical role. There is a nurse assistant who advanced practice nurse who has specialist education and training in anesthesia. Also, there is a nursing anesthesia who specialize in education and have a training in anesthesia. On the other hand, there are a lot of other non-clinical roles in the medical industry, such as medical transcription, pharmaceutical representative, biomedical engineering, medical recruiter, and medical device sales. The education and the skills required related to non-clinical job is multi-professional strategy incorporating elements of higher professional education in general practice and others. Also, there is a particular management leadership training. Also, it needs the skills like communication, leadership, quality improvement, the patient perspective, teaching, and working on the team. Example of non-clinical job is that someone must be health risk management manager. That person must be responsible for overseeing and minimizing error, accident, or anything that could prompt a malpractice suit. You will need a strong understanding of health professional and procedure in order to help minimize risk and liabilities. You will organize and implement staff training to ensure that proper patient care and safety measures are understood and met. Here there is also allied health. Maybe defined as those health professionals that are distinct from medicine and nursing. The most allied health jobs are deputy chief executive officer, first assistant, hospital Also, there is a staff nurse, occupational therapist, PAJAM, medical director, clinical informatics, hospital staff nurse. Most of example of area healthcare job are nuclear medicine, technology, occupational therapy, physical therapy, physician. For example, if you are a medical assistant, you have one of the bad job description in the area of healthcare, managing both administrative and clinical tasks. Their duty vary based on their location, employer, specifically, and the size of the practice. Also, the job may involve directly patient care and treatment, or it can involve around patient record and health information data management. After that, there is a research practice NASA and the research vocation NASA. Both provide basic medical care. They work under the direction of registered NASA and doctor. Their duty is that research practice and research vocation NASA typically do the following. The first one is monitor patient health, for example, by checking their blood pressure. Also, there is administer basic patient care, including changing bandage and inserting catheters. Also, there is a provider for the basic comfort of patients, such as helping them bath or dress, discuss the care they are providing with patient, and listen to their concern. Also, they report patient status and concern to register NASA and doctor. Also, they keep record of patient health. The job prospect should be favorable for recent practice and recent vocation NASA who are willing to work in rural and medical underserved area. Employer also may prefer candidate who has certificate in specific areas such as gerontology or intravenous therapy. I say thank you for your understanding.